So this is part 2 of my surgery experience. I was saying that I was back in the Holden area. My surgeon actually came out to tell me what was taking so long with the other patient. He was really stressed out when he came and talked to me, but he said that I was going to do just fine. But yeah, I was given happy juice, and then they finally came and took me to the OR. I remember being wheeled back there and seeing all the whiteness and bright lights and everything, and I was out completely. I woke up in recovery. I don't remember much at all. I wasn't in pain really. It was a different kind of experience because my past 2 surgeries I remember a lot from the holding and recovery areas and the operating room, but I don't really remember a lot this time around. But I was wheeled in my room, and my husband and his mom was there, and I remember that it was just so hard for me to open my eyes. I wanted to talk to my husband so badly and look at him, but I just couldn't keep my eyes open. My surgery took about 30 minutes, I guess. I was in my surgery started actually about 3 o'clock. I was out of recovery in my room at about 5:30, I guess. And that night I just slept while the nurses, well, I tried to sleep while the nurses poked and prodded me all night long, taking blood, giving me breathing treatments, taking my vitals. Yeah, so the next morning I woke up about 5:30. Somebody woke me up to give me a breathing treatment, I believe. And then they told me that I was going to go around 8 o'clock for my little bariograph type thing. And my mother-in-law came right before I had my little bariograph. I was feeling really well then. I was alert. I wasn't really in pain at all. I had used my morphine drip a few times during the night when I woke up, but I quit using it at 8 o'clock the morning after my surgery. I tolerate pain very well, and it wasn't really painful. It was just a kind of soreness, so I quit using it. I don't really like pain medications because I know they're easy to get hooked on, so I just quit taking it. Let's see, my bariograph. Let's see, in the morning they took out my catheter, they unhooked my blood pressure cuff, they took my oxygen off, and all this was about 7 o'clock that morning. I think that's all I had hooked up. Oh, I had my little compression things on my legs so I wouldn't get blood clots. They unhooked that, and I was able to get up and wheel my IV to the bathroom, and it was really nice to sit down and use the bathroom. Well, it's actually just really nice to get up and walk. Yeah, so I was alert then. The technician came to take me to my radiograph thing, and I got there, and it was just really hot in the room. I started sweating and feeling nauseous and dizzy. I really don't know why, but I could barely get up out of the wheelchair to go stand in front of the x-ray thing. So I had to do it like twice, I think. It was really bad, but once I got up to the room and it was cool and everything, I started feeling a whole lot better. So I just think it was the heat down there and just the stress of actually getting out of my room for the first time. But after that, I stayed in my room the whole day. My mother-in-law left about 10:15, and then I was alone until about 9 o'clock that night. I liked my nurses a lot. We talked and chatted and goofed off a little bit. I didn't really watch TV. I really couldn't concentrate on anything. I didn't read a book. I just kind of sat there. But the time passed quickly. I wasn't in pain. Yeah. I mean, I was interrupted like maybe every hour. A nurse or a tech came in or something like that. They told me to walk the hall a little bit and to work up walking around the whole floor that I was on. And I finally got out and did that. And I actually walked the whole floor for the first time. I didn't have to work up towards it. The second time I got out to walk, I ran into my surgeon in the hall. He was coming out of another patient's room, and he said that I was just about the easiest person that he's operated on, and my insides were actually like absolutely beautiful. I had no problems at all. And he said that since I was alert and not in pain and walking around, and I was walking at a good pace too, that he's not even going to stop by and see me to check on how I'm doing, and that I could leave the next morning. So that was my hospital experience. That night I didn't sleep very much at all. I still had people coming in and bothering me. I pumped a little morphine that night to help me sleep. It didn't do anything except give me a really big headache. So the nurse gave me some Fioricet, and that stuff is awesome for a headache. I started taking my antidepressants that day. The nurses on my floor, they weren't really well versed in other medications, I guess. My Wellbutrin is a big old tablet, and there is no way that I could swallow it. It would have gotten crushed. It would have gotten stuck in my pouch. So I had to ask her to crush it up. I undid my Prozac and sprinkled it in my soup. But I asked the surgeon's assistant yesterday right before I left if it was okay to take Prozac. And he said it was okay to take the capsule, but I would still have to chop up my Wellbutrin. So that night I didn't get a lot of sleep, so I watched infomercials all night long, and there are like tons of stuff I want to buy now. I finally got to sleep about 5 o'clock in the morning, I guess, and I slept off and on until about 8. And so then it's the next day in the hospital, and I'm going to stop right here and talk about that.